Hi everyone, Professor Besco here, and this is a brief tutorial on seating and positioning. So as special education teachers, you do need to have a basic knowledge of seating and positioning, but this is not something that you as a special education teacher would be recommending for a student. If you really felt that a student was struggling and not sitting appropriately, whether they're in a wheelchair or they don't seem to be fitting the furniture in the room. This might be something that you might refer to your physical therapist in your building to find out a better furniture fit or seating option for a student. So to go into that, let's advance here and take a look at some basic information about seating and positioning. So in looking at a student in a general education classroom or a self-contained classroom and the child is not in a wheelchair, we want to make sure that one, that the furniture is appropriate to the size of the child, and that we are looking at angles. So they call it the 90-90-90 rule. So you want to make sure here that the child's hips are to the back of the chair, that their knees are flexed at a 90-degree angle, and that their feet are on the floor. So they shouldn't be dangling in midair. If you have that, then we need to make some alterations to the seating situation if another chair is not available or a desk is not available. So we might have to kind of doctor that so that we have this 90-90-90 rule in place. Now, this is really important that the child is seated properly because it's going to impact their penmanship. So if you have a student who is struggling with writing and is very sloppy, it may be that they're not sitting correctly and it's going to impact the way they write. Not only that, but if you have a child who is struggling with eating, if they're struggling with speech, maybe they're very breathy and they're really struggling, again, you need to look at seating because if you are implementing the 90-90-90 rule, then their ability to speak should be improved because you have better diaphragmatic breathing when you are seated appropriately. So that's really important. And then also, once again, very important, especially if you're in a self-contained classroom and you're working on feeding. And again, this would be something that your speech therapist would also be doing. But again, the 90-90-90 rule applies because the student should be in an upright position when they're eating because it impacts swallowing. So just always keep that in mind. So what are some other things that we can do if we have a student who maybe is sliding out of the chair because maybe it's the fabric that they're wearing is an issue. You might want to use something like Dyson right here. It's just kind of like a sticky tacky piece of film that you can put on a chair that would prevent a child from sliding. Another alternative to that is just simply getting a roll of non-stick grip cabinet liners. You can usually get them at like a dollar store or at a Walmart or a Target, and you will get the same effect as Dyson because Dyson can be pretty expensive, but it's very effective. So it's kind of one of those like low-tech alternatives that you can utilize. Some children will have sensory issues, and you might find that they would do better if there was a cushion underneath them. So you can do like a disc cushion. And as I said before, if there are sensory issues, some of them have bumps, ridges, and that's something that you would probably work with your occupational or your physical therapy on in identifying the best seat cushion for your student. I had mentioned before that feet support is very important, that their knees and their feet should all be at a 90-degree angle. If that is not the case, then you might want to look at bouncy bands. We looked at this. This is a great tool for somebody who has ADHD, but this also works out great for students who need sensory input, so they can bounce their feet and keep themselves busy while they're attending to the classroom teacher. But also, if you have the issue where you don't have a chair that allows the child to have their feet at a 90-degree angle, then a TheraBand or a bouncy band would help you to um, get that child in the appropriate setting. This I'm not sure about. Obviously, this is a little step stool. Now, this is secure. I know it might not look it, but the legs of the chair are actually in the in this little hole here. So it's not that the chair is going to tip over. But you need to be careful that this doesn't become a safety issue, and same thing with books. But these are just some examples. Now, let's talk about wheelchairs. If you have a student in a wheelchair, there's a bunch of different wheelchairs out there. Um, a student may be in a temporary wheelchair, for which would be something like this, a manual wheelchair that we're all pretty familiar with. But if you have a student who is using a wheelchair for mobility and support, you might have one that's called a tilt in space wheelchair. So this is one that you as the teacher would be able and should be moving the child in different angles and directions throughout the day, and it's usually prescribed by either a physical therapist or a medical doctor on how often you should be maneuvering the chair if it's a tilt in space. So it can go back, it can go forward. You can see right here we have a communication device attached to this chair. And again, this is a chair that you would have if you had a student with a lot of medical needs who was fragile and didn't have a lot of voluntary muscle support. So they might be in a tilt in space wheelchair. And then you have your motorized wheelchairs. And again, these come in all different shapes, styles. This is a joystick controller. The controller can be a switch that's mounted onto the headrest. There's many, many alternatives. And again, this would be essentially prescribed by a physical therapist who specializes in seating and positioning. So, but these are some wheelchairs that you could possibly see in your classroom. Now, some alternative chairs is you may have heard of a Riften chair. You can see that a Riften chair, and depending on your school, you might have some really old wooden Riften chairs, but you can see these are updated Riften chairs with cushions and supports. They have seat belts on them to keep a child from sliding. They have arm support in case a child needs that. Many times when you have arm support, you can also slide a tray onto the chair. So you would have a writing surface as opposed to trying to pull a chair like this up to a desk. So you would have that, or sometimes the arms can be moved so that you could slide it underneath the desk. So there's all different types of configurations, as you can just simply see in these three chairs right here. And again, right here we have a footrest. Again, this would definitely be coming from a physical therapist, the recommendation as to what chair would be appropriate. And if we have a child who needs an alternative seating arrangement, such as a Riften chair or a wheelchair, um, you most likely will also need to have a stander in place because you can't remain seated for extended period of time. So something like this standard would also probably be available in your classroom if you have a child who is wheelchair bound or if they're using a Riften chair. So this is just a brief overview of just some of the seating and positioning issues, as well as some alternative chairs that may be in your classroom someday.